My full name is Munira Kapadia. I am an associate professor of surgery in the division of gastrointestinal surgery. I became a doctor because I wanted to help people. I know it sounds cliche, but I really did want to help people. I had all these amazing, strong role models in my life that are women and that also happen to be doctors. My mom's a doctor, my aunt's a doctor, my mother's aunt, so my great aunt was the first woman doctor in our community in India. And so I really have had a strong legacy in my family of female physicians, and I wanted to do the same thing. I think colorectal surgery is the most amazing field. I love that there's so much variety within the specialty. I do some open abdominal surgery, I do laparoscopic surgery, I do robotic surgery. I do abdominal surgery and anorectal surgery. I do benign surgery, meaning non-cancerous surgery. I also do surgery for cancer patients. So I really get a nice variety of patients to take care of and a nice variety of disease processes to treat. And I think it's literally the most amazing specialty within general surgery. I also really like the fact that I get to develop a lot of long-term relationships with patients, which is incredibly important to me. And I like that my specialty has to take into account what their life is about, what functions for them. What I mean by function is we have to take into account how well their GI tract functions. Are they able to control their bowel movements? If they're not able to, what are our options? What things can we do to make their life better? Can we implant a device that helps their intestines to function better, and specifically their anus and their rectum? Do we need to consider a colostomy? There's not always a completely straightforward answer, but taking into account what is going on with the patient in terms of their disease process that we're treating and what their lifestyle is about, we're able to meld those two things and figure out a solution that would make their life better. A colorectal surgeon works on the intestines, the small intestine, the large intestine, which includes the colon and rectum, and the anus. We take care of patients that have issues with one of those things. The types of things that we take care of: diverticulitis, colon and rectal cancer, inflammatory bowel disease such as ulcerative colitis or Crohn's. And then we also take care of pelvic floor disorders, things like constipation, fecal incontinence, or rectal prolapse, and finally anorectal disorders, things like hemorrhoids, fissures, fistulas, anal cancer. Most of the time patients come to me with a very specific problem. So we look at what is the problem, what is the best medical treatment for that problem, but also what is their life about. We take all of those things into consideration when we make a decision about what we're going to do, how we're going to do it, etc. I would like them to know that I value who they are as a person, and I want to do everything to make their life better. I want patients to know how much I value communicating with them. It's the number one most important thing that I do with a patient, because of course I operate on them and I take care of their insides, but I have to be able to explain what I'm going to do before surgery, during the operation, and what things are going to be like after surgery. And that's the thing that I really value most, is how I communicate with patients. I think being somebody who values effective communication, I really recognize what a difference effective communication between me and the patient, like what that results in for the patient. And I hope that patients are more comfortable because we've had good discussions about what's going to happen at all stages of the surgical process. Setting patient expectations and concerns about surgery, aligning those expectations with what is actually possible. Some of it is bedside manner, demonstrating empathy when patients need that, and acting as part of their support system anyway. Acting as part of their support system is incredibly important.